Hello everybody, my name is Dr. Richard Teams. I'm an anesthesiologist. I've been practicing regional anesthesia and acute pain management for over 15 years. And for these videos, we are going to be talking all things regional anesthesia and nerve blocks. Welcome to the Block Show. In this segment, we'll be discussing upper extremity nerve block techniques, including interscaling, superior trunk, and supraclavicular nerve blocks. We'll be discussing medications, dosing, indications for these nerve blocks, as well as anatomy and neuroanatomy. Here we're going to be discussing the anatomy of the brachial plexus. In this image here, you can see the roots, trunks, divisions, cords, and the terminal branches of the brachial plexus. For the interscaling nerve block, we block the roots of the brachial plexus, whereas for a supraclavicular nerve block, we will block the divisions. A superior trunk block is just that. It's blocking the superior trunk of the brachial plexus. It's interesting to note the branch point for the suprascapular nerve. It comes off of C5 and typically can be missed when you do a supraclavicular nerve block. Also, it can be missed when you do a superior trunk block. This is why sometimes for shoulder surgeries, patients can have pain postoperatively because that nerve is missed if you don't do an interscaling nerve block. Also interesting to note, the dorsal scapular nerve comes off of C5. That nerve will run inside of the middle scalene muscle and sometimes can be hit while trying to perform an interscaling nerve block. We will demonstrate this when we go into the specific videos about interscaling nerve blocks, where I will show you this nerve and how to avoid it. The neuroanatomy for an interscaling nerve block consists, as I said, the roots. Typically, you will see the C5, C6, and the second C6 nerve root, along with sometimes the C7 nerve root. Local anesthetic is ideally placed in between the C5 and C6 nerve roots while performing an interscaling nerve block. While performing a supraclavicular nerve block, you want to first identify the supraclavicular artery. Underneath the artery, you will notice the first rib. Just to the lateral aspect of the artery is the brachial plexus. If you move out laterally further still to the apex of the brachial plexus, you can sometimes see the suprascapular nerve. This sometimes can be blocked there and also hit as you are going in to do this nerve block. Ideally, you want to first go to the corner pocket while performing this nerve block. This is usually at the 7 o'clock position of the artery, which you can see here. After this, you want to bring your needle back and put the rest of the local anesthetic amidst the rest of the divisions of the brachial plexus at the 9 and 12 o'clock positions of the brachial plexus around the supraclavicular artery. For a superior truncal block, you want to first start at the supraclavicular nerve block technique. Then moving cephalad, you will follow the superior part of the brachial plexus until you see the superior trunk form between the anterior and middle scalene muscles. This is where you will perform a superior trunk block. Upper extremity nerve blocks can be used for all sorts of upper extremity surgeries. Specifically for interscaling nerve blocks, they should be used only for two types of surgeries. The first type is any type of shoulder surgery, from the proximal humerus proximally. The second indication for interscaling nerve blocks would be for clavicle fractures. In addition to an interscaling nerve block, it is also important to add a superficial cervical plexus block for clavicle fractures. A superficial cervical plexus will help with the incision for an open clavicle fracture. For superior trunk blocks, the indication for the use of this block would be for shoulder surgeries. This is a newer technique that has been described in literature for the purpose of trying to mitigate phrenic nerve involvement. As it is more distal from the roots and therefore further away from the phrenic nerve, the thought there is that you can mitigate a lot of phrenic nerve or diaphragm palsy by doing this block technique. For the supraclavicular nerve block, the indications for its use is for any other surgery or procedure of the upper extremity. This nerve block is known as the spinal of the arm and encompasses everything from the tip of the fingers to the midshaft of the humerus. This is the go-to nerve block for all other procedures. It encompasses the ulnar nerve, the radial nerve, the median nerve, and even gets the musculocutaneous nerve.